so you don't forget it the way Allison did earlier.
Busted.
That number is 226-377-2651.
Thanks, Josiah. You're listening to Afternoon Drive on CBC Radio 1, heard at 91.9 FM in Leamington and 88.7 FM in Tillsonburg. Nurses have been on the front lines of the pandemic in this province for more than 2 years now, and a recent survey by their union found that more than 3/4 of them are burnt out. The survey also says that 69% of the nurses who took part plan to leave their jobs in the next 5 years. My next guest is one of those nurses looking to get out. Karina Frost started working as a nurse in 2020. Good afternoon.
Good afternoon, Allison.
So what was it like for you entering this profession 2 years ago?
It was very much like out of the frying pan and into the fire, so to speak. I graduated in 2020, so we were the class of COVID-19. Our consolidation semester never happened. And your consolidation semester is when we're supposed to be taking on full patient assignments under the supervision of an RN preceptor. And we weren't allowed in the hospital because of COVID. So by the time I started my first hospital job, I had not been in a hospital for 6 months. It was a struggle to catch up with learning. And not only that, they were already starting to increase our workload assignments due to shortages and the amount of patients that were sick. And like staffing ratios in general have gone down the toilet. So in many hospitals, a lot of times recently there will be like 2 nurses for 22 patients, which is 11 patients per nurse, which is incredibly unsafe. And I haven't experienced that yet, but we have experienced some pretty severe staffing shortages in my current unit.
So what was that like for you, the timing of that all? What had led you to want to get into nursing in the first place?
So I had actually wanted to become a nurse since I was 4 years old. I remember my grandmother had been in the hospital and I went to go visit her. And instead of being scared, I remember seeing everybody working together and I got really, really excited. And because I had failed high school chemistry, I couldn't get into a 4-year nursing program. So I went a different route. I became a social worker. And then about 10 years into the profession, I decided, you know what, I still want to go after this dream. I want to become a nurse. So I did a 2-year accelerated program for people who had already had bachelor's degrees in prior education. I just ended up having to become a nurse at the worst time possible.
Right. And it sounds as though you really had the fire in your belly to become a nurse in the first place. It was a childhood dream and something you were also changing professions to do this. Why are you planning to leave your job as a nurse so soon after you started?
So it's not necessarily I'm leaving the job, I'm leaving bedside. One of the things about nursing is that it's one of those professions where it's so wide and so varied. Your license really is a tool. You can pretty much do whatever you want with it. You're not necessarily chained to bedside nursing. So prior to becoming a nurse, like I said, I was a social worker and I worked for the federal correctional system and I worked with a lot of offenders. So I'm kind of angling to maybe go back towards working with that population, but this time as an RN and not as a social worker.
What would you say are the biggest issues that need to be addressed for nurses in this province right now?
So there's a lot of things that need to be addressed. I do feel that public health measures need to be re-implemented. So this means reintroducing a mask mandate and vaccine passports. 3rd and 4th doses of the vaccine need to be pushed, and 4th doses need to be started for everybody. And this will put less stress on our healthcare system as less people will become sick. And it's I know Ford likes to brag about all these ICU beds, but with no nurses to staff them, a bed is just that, it's a bed. In regards to retaining nurses, in addition to getting rid of Bill 124, we are burnt out and we are in desperate need of mental health supports, and they need to provide them for us. So if you're a full-time nurse, you get $500 to $800 per calendar year in benefits, but that's only accessible to nurses who have these benefits. And a vast number of nurses are only casual or part-time in this province, and they don't get access to them. So mental health support, getting rid of Bill 24, you need to make the profession more attractive. People don't want to go into a profession where, they know that they're going to be short-staffed every day, severely underpaid, and just getting more and more work, and then just getting paid less and less, especially with the rising cost of living that's currently going on in Ontario.
There has been a lot of campaigning against the government's Bill 124, which caps public sector raises at 1%. Why do you think that's such a flashpoint?
It's a flashpoint because the inflation point right now is 7% or something. And it seems that female-dominated professions were attacked within this bill. So I feel that the bill in and of itself is misogynistic, because you aren't seeing salary caps with police and with firefighters, but you're seeing it with PSWs, you're seeing it with nurses. And I mean, nurses are what makes hospitals run. Like, you can build as many hospitals as you want, but without nurses to staff them, it literally is just a building.
What do you want to hear from the political parties in this campaign? What would make the biggest difference for keeping nurses?
Attracting more nurses to the profession by, abolishing Bill 124. Just take it away and give us a chance to bargain for fair wages. Give us incentives to stay. Give us incentives to become nurses and to attract nurses into the profession. It's such a great profession, and I've really gotten a lot out of it. But I mean, the amount of money that we're paid for the stress that we're having to take on and put up with continuously because of a poorly managed pandemic response, isn't really worth it.
And Karina, what sort of timeline are you on right now? When do you expect to be leaving bedside nursing?
I am hoping to leave bedside nursing within the next year or so.
Well, your points are all well taken. Thank you so much for coming on the show to share your experience with us.
Thank you so much for having me, Allison. I truly appreciate it.
Karina Frost is a registered nurse in this province, and she is planning to leave the profession. Are you a nurse who's experiencing the same feelings? Maybe you have another take on the current situation in healthcare. You can send us your story or contact to our text line. It's 226-377-2651. That's 226-377-2651. So on Friday, the Vatican formally